Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Dedito, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we will look at what is telehealth, what it is, how it works, and the science behind it. Millions of people with diabetes, hypertension, and even heart diseases visit hospitals every month. Many wait for hours, some wait for days, and some have to travel for long distances. But what if I told you that you can get the same care or sometimes better from your home just using your phone? This is not the future. This is happening now. So, hello friends. Welcome back to the Overall Health YouTube channel. And in this video, we are going to look at what is telehealth and what does telehealth mean. It means that you have a consultation with your doctor through a phone, connecting either through a normal call or through a video call. And you can send your doctors your readings. Possibly you have been monitoring your blood pressure, you have been monitoring your blood sugar, and you have also been monitoring your weight. So this is an interface that will allow you to interact with your doctor without you having to go to the health facility at the comfort of your home, and your doctor can see how your reading have been. So then the doctor will also be able to track your symptoms at the comfort of your home, and he will be using the assistance of remote devices so that he can monitor some of the parameters that you have been monitoring. And then you can either talk to him directly, or you can be sending him digital messages. And also he can also send you digital messages, either as reminders or even follow-ups. So it is the care that brings the health providers at your disposal, at the comfort of your home or where you are, without you having to spend time traveling to the hospital or to the clinic. This became very important, especially around the COVID time, when we had the lockdown and the patients could not be able to move from their home to the hospitals because of the lockdowns that were there at that time, and people are restricted to stay indoors. And so this is how the technology of the telehealth mostly developed, and it has been shown that it actually can be continued, and patients will get better care through this telehealth. So why is telehealth better? So there have been some studies that have been done from 2023 up to date, and this is what they have shown. One, diabetes patients using telehealth have better sugar control. This is a very important aspect in the diabetes control. So the aggregated hemoglobin, this is the amount of glucose attached to red blood cell measured in 3 months interval, dropped significantly more than the clinic-only patient. This is because of the frequent checking from the doctor, because the doctor can check on the patient at their comfort, and also the doctor when he has time, or he can schedule time to check on his patient. And then there is also a better feedback loop. Because of the continuous interaction between the doctor and the patient, then if patients have issues, they are always able to reach their health provider. Then for patients with hypertension, it was shown that their blood pressure improved at the telehealth. Patients could send their blood pressure readings daily to their doctor, and this provided opportunity for better monitoring. The doctor could adjust the medication quickly, and also there were fewer emergencies because of that connection between the doctor and the patient. And then also the other good thing about this telehealth is that for the lifestyle or things, the doctor can emphasize or patient can give feedback to their health provider about the health lifestyle adjustments, be it things related to their diet, their exercises, their sleep, their stress management, where they can get guidance and be able to adjust accordingly. Patients who had chronic heart failure had fewer admissions because the remote monitoring systems spotted problems early. And then daily weight and heart rate tracking saved patients' lives. And also it has been shown that telehealth saves patients money. Of course, there is no need for transport. There is no need to go to the hospital. And if you need to go to the hospital, then it is only when it's very necessary. And you have fewer unnecessary visits because you can engage with your doctor on the online platform. And this also removes the aspect of disturbing patients from their daily routines. For example, if it's someone who is elderly, they are working on their farm, they will leave their job, they'll have relatives come possibly to pick them and bring them to the hospital. So all these are savings that can be accrued from telehealth. Then 90% of the chronic patients said that telehealth improved their understanding of their illnesses. Why is this so? Because there is better education on the telehealth platform. The patient can ask questions. There is more engagement. There is more time with the doctor, and there is less stress. So you are not stressed by the issues of travel. So the time that you use on the road, because when you visit the health facility, possibly the transport means that you use is getting not available, then you are in a hurry. But when you are at the comfort of your home, you are not bothered about weather, about traffic jams. So you can ask any question that you have, and that anxiety of the travel, you are saved from it. In telehealth, there was no increase in hospital admissions. So large studies have shown there is equal or better outcomes in patients who are followed up through telemedicine. And most conditions could be managed safely at home. And this is very important, especially for patients who have chronic conditions. They have what we call code visits, just going to the doctor to check up how they are doing and what they need to adjust. So, and then also with telehealth, there was improved medication adherence. So patients remembered medicine better. Doctors could monitor compliance because they are keeping calling on as necessary, and patients can schedule call-ins when necessary. So this is not guesswork. This is studies that have been done, and this is what they have shown. Those are improvements of in telehealth. So that is what science and scientific studies have shown. So what are the benefits of telehealth? When you are seen from the comfort of your home, what benefits do you accrue? One, there's no waiting time because once you agree with the doctor at a particular time, then you are ready and the consultation can take on. There is more doctor time because the doctor has time for you. There is more room for follow-up because of the convenience of all the parties involved. There is early warning if there are things that are not going on right. Your healthcare provider is able to know what is happening. It is easier for the elderly, especially when you have to move them from rural areas, bring them to the health facility, which might not be far, might be far. Then this is also for help for rural patients who do not have to leave the comfort of their daily routines to go for checkups. It saves money, as we have said. You don't have to leave your work. You don't have to spend fare. You don't have to have your relatives leave their work to take someone to hospital. Then it also reduces burnout. You can imagine the distress of having to organize for transport. Sometimes you have to organize for a taxi, and these cost money. Then, of course, it improves self-care. Patients realize that it is not their doctor who is in charge, but it is themselves. So it gives them autonomy and power to take care of their health in a better way. It reduces emergencies because your doctor is constantly in touch with you as necessary. And so for any complication that might arise, he's well informed on time. It improves access to care because of those who cannot be able to travel, and also for those people who are in rural areas and they cannot access specialist care, then it becomes very convenient, and it removes stigma. That aspect of having to go to the hospital, worried about your next door neighbor seeing you in a hospital, knowing that you are sick. Not everybody want this to happen to them that you have seen in the hospital. Some of these things people want to handle them privately. Then there are some of the limitations despite the good thing about telehealth. One is that the doctor is not able to examine you. So he will not be able to listen to your lungs, he will not be able to check if you have swellings. He will rely on the vital signs that you have been taking for yourself, and it is also impossible to run tests. Though these days also, if there are tests needed, you can also have your blood samples taken at home, the test done, and even the communication mechanism is helping patients even to get drugs at the comfort of your home. You have your drugs delivered to where you are. And of course, if there are emergencies, then you need to show up in person to the hospital. If you need any operation, then you have to show up to the hospital or the clinic. And also, there is the challenge of internet, and also the other challenge that happens with this telecommunication sometimes, the convenience or the privacy of the consultation can be affected by the people around the patient. Sometimes there are things that the patients want to discuss in private, but they are with other people. So this can affect the privacy of the consultation. So when times that when in-person visit is essential. One, if a patient develops new symptoms which the doctor might not be aware about, if someone has chest pain that you think that could be an emergency, if the patient has vision problems, if patient develop things like foot ulcers and diabetes that might need. So in a nutshell, when you have telehealth plus clinic visits combined in a hybrid, then you get the best of the care. So you have fewer visits when necessary, but the rest of the time that things are stable, your doctor can consult online. So what is the future of this hybrid care? He just said that the future is hybrid care, and personally as a family physician, and I have a coaching program for people with chronic diseases, those who want to reduce weight, those who want to control their blood pressure, their blood sugar. We have been doing these online consultations, and we realize that the hybrid fashion, whereby you can keep communicating on a weekly basis with the patients, and then once in a month, they can show up at the health facility for some specific measurements, then it makes the care the best. And say, so 70% of the care can be done online. Then 30% is done in person. The devices can be used for remote monitoring. Then the doctor can adjust the care daily as necessary. And also there is better education because the doctor has time to talk with the patient without interruption. And there is also better engagement because the more you engage with your patients and your clients, you become friends, you get to open up more to you, and then you are able to help them much better in a way that is more convenient to them. So I have seen patients with diabetes, and I have followed them, some mostly on the issues of lifestyle. I get feedback on what patients are doing about their diet. We discuss how their meals have been, what we need to adjust. We discuss what they have been doing for exercise, and see whether they are doing adequate or they need to add more. Then there is the issue of sleep, how patients are managing stress in their daily routines. And even when issues come up, like a patient has an experience that he does not know what exactly to do, then we are able to discuss this during the call in. And this saves the patients the anxiety of having to go to the hospital. Sometimes patients have drugs, sometimes they may experience some side effects of the drug, or something else could have happened and the patient are not really sure whether it is the drug or whether it's something else. So this helps patients. And I've seen that through this type of engagement, some patients have been able to lose almost more than between 10 to 20%. They have had their blood pressure well controlled, they have improved their glycated hemoglobin, and some of them we have been able to help them reverse pre-diabetes without much ado. So as a doctor, I see patients sooner because of the telecommunication, and also it helps me to adjust situations earlier before they go too long in the long direction, and it also gives the patients comfort when they have uncertainties that they might be concerned about. So telehealth is not replacing the clinics, but it is making care better, faster, and also safer. And your health matters a lot. And so we need to walk this journey with you. And the only way and the best way to walk this journey together is through telehealth. So if you really want to take charge of your health, then telehealth is one of the things that you should consider. And we have the internet, which has made it possible, and also the technological advancement and the use of wearables and the availability of gadgets. So remember to subscribe, like and share this video, and also share it with someone so that they discover an easier way to stay healthy. I'm Dr. Joshua Dedito, your family physician. Thank you for watching. We'll meet in the next video.